Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today, I would like to talk about flexibility and how to improve it. And before we even get into that, let's talk about why we want to improve it. So I think we all know what flexibility is. It's how extensible are your muscles, how limited are you in your movement, your range of motion. The word mobility gets thrown around a lot. Mobility is kind of like an active flexibility, so how far can you take your joints while under control is probably one way to think of it. So first, let's just differentiate between active and passive, because that becomes a big part of how to improve it. So passive mobility is, let's just take the hamstring for example. If you're laying on your back, how far can I push your leg back to stretch that hamstring? Or, some sort of external device, like you have a strap around your foot and you're pulling up with your hands or a towel. How far can you bring it passively? Active is the opposite. It's just you're using only your muscle. No one's pushing on you. How far can you actively stretch that hamstring out? So picture you're sitting on the edge of the bed, sitting up tall and straight, and you extend your leg out and lift your toes up towards the ceiling. Can you do that fully? That's an expression of active mobility. And active mobility is usually, or as almost always, limited versus passive. So rule of thumb is most joints, you can passively push 5 degrees or so past where your active mobility ends. And that's generally what you're chasing. You're chasing that few degrees past where you are actively. So why stretch? Why mobilize? A lot of people, I think, falsely believe that stretching cures pain, and it's all about stretching. We hear these things a lot as physios. And there are certainly times where a mobility issue is causing a movement problem, and that turns up to pain. So it's almost like an indirect measure. I will say stretching does have kind of an analgesic or temporary pain-killing quality. But there are definitely times where it's not appropriate to stretch. You could have a sciatic nerve irritation. The last thing you want to do is stretch your hamstring. That's a bad idea because you're going to irritate the nerve. You can also have hypermobility. The joints are too flexible, or the muscles are too flexible, and the joints have too much motion, and that creates a destabilizing effect on the body. And then you can have pain with that. In fact, I treat a fair amount of yoga instructors for that one reason. People tend to do what they're good at. So if you're flexible, you tend to like yoga. If you're strong, you tend to like lifting. And just as a general principle, it kind of should be the opposite. People that are stiff and strong maybe should do a little more yoga, and yoga instructors should probably do some more strength training. But anyways, so if you're already pretty mobile and flexible, and you get good at yoga, and you love yoga, then your chances are for the instructors, I would say, you went down that pathway, started off being generally pretty good at naturally, and then they continue to stretch, and then they destabilize things like their pelvis and back, and so that creates all kinds of issues. So there's definitely times where it's appropriate and times where it's not appropriate to stretch. By the way, if you have a strained muscle, don't stretch, at least not initially. A strain is technically a type of tear. And if you had a tear in your shirt, the last thing you'd want to do is pull on the tear. The same principle exists. You want those fibers to be in approximation to each other so they have a chance to heal. Down the road, it'd be okay to stretch it, but not initially. And let me just tell one quick story. So I had a client of mine, and she was a dancer. And dancers stretch their hamstrings a lot, and they're obsessed with getting more mobility, because that's the demands of that sport. So she actually had torn her hamstring, had it surgically repaired. She saw a physical therapist. Unfortunately, that physical therapist continued to stretch her, and she retore it, had surgery a second time. So when she saw me, I looked at her mobility. I mean, I could basically put her shin to her nose. And when I would do this, she'd like, "Oh my God, that feels so tight." I'm like, that is not tight at all. You have too much mobility. We have to stop stretching your hamstring. You got to get it strong, and that's what solved it for her. In fact, I actually read an article that the Australian ballet has stopped stretching hamstrings, probably from recurrent hamstring tears. I'm not sure where all this sort of obsession around hamstrings comes from. Is it the sit and reach test? The sit and reach test is probably the least functional test that has any validity at all. Okay, so this is not to say that stretching is bad. There's definitely times to stretch. So when do we stretch? When you have a range of motion deficit that is either creating a pain problem or limiting you from something. All right, so let's take golf. I have a lot of golfers down here, and you need to be able to rotate your whole body about 90 degrees to swing in either direction, because you get the backswing and the fall through. And a lot of that mobility comes from the hip and spine. And sure, you're getting some from the ankle, knee, and stuff like that, but roughly you need about 30 to 40 degrees of hip internal rotation and about that amount on your spine as well. So I'll look at those measurements, and if they're limited, and if they're having back pain, we are probably going to be chasing that range of motion deficit. There are definitely times where, and this is a super common one, ankle mobility is limited, probably because of shoe wearers and, our lifestyles. So if you're missing ankle dorsiflexion, so think of the opposite of stepping on a gas pedal, lifting toes up towards the nose, so that's ankle dorsiflexion, because you have a stiff capsule, or your calf, your soleus is stiff. It could be muscular, it could be capsule, it could be both, usually is both. And then you aren't able to maximally dorsiflex. When you go into a deep squat, you're going to have a compensation. Now, I'm not going to tell you there's a right and wrong way to squat unless it creates a problem. So it's only a problem if it's a problem, if it's causing some pain. You can have kind of an ugly-looking squat and still be pretty strong and get some good numbers, but there's definitely not right or wrong. There may be better and less better ways to do it. So anyway, if you're missing ankle range of motion, specifically dorsiflexion, when you get down to the bottom of your squat, something's going to happen. So the common compensations we'll see is either the heels will elevate, or a lot of people know you're supposed to keep your heels down. So the other thing is the feet will evert. They'll turn the feet out as a way to get away from the stretch of the calf. And you usually get this counter lean. So you'll see this squat position where the angle of the torso is pretty far away from vertical. It's almost like horizontal. That is a counter lean because the calves are stiff, driving your weight is basically trying to push you backwards. You counter lean against that. So if you picture that's what's going on, and you put a lot of weight on your back, now suddenly your back is taking out a lot of load. So sometimes that creates issues. So that is the reason to fix ankle dorsiflexion. So it's not to fix calf pain. It's to fix the compensation that's created back pain. So that covers the why stretch or mobilize. Then the next question is, well, what causes the stiffness in the first place? So two things come to mind. Number one is adaptation, and number two is protection. So adaptation meaning that the body is always turning over cells, and when you have these new cells that are born, what you do, or the input you give the cells changes how they express themselves and what they become and how tissues form. So what happens is if you hold any muscle or joint in a particular position for a long time, it adapts to that shape. So most of us in the United States, we sit in chairs at 90-degree angles. So that means the hip flexors get stiff in that 90-degree position. Hamstrings get stiff because of the position we're always in. You go to other countries, like I spent some time in the Philippines, and everybody eats lunch. Well, most people eat lunch like in a deep squat, like ass to grass squat. And I am willing to bet that knee pain is way lower there. Anyway, because of the positions we adopt chronically over time, those have become the areas we tend to develop stiffness. When you go to the grocery store and you see some older folks that are looking kind of stiff, they're kind of bent over, hold on to that grocery cart. A lot of them, unfortunately, have just become sedentary and sort of molded into the shape of the couch. And let me just pause on that one specific example because that's a good illustration of when I stretch hip flexors. Hip flexors get blamed for a lot of stuff, but they certainly can be the cause of low back pain. It's a little bit over-diagnosed. But for those that are doing a lot of sitting in life, especially people that work at a desk, and it's got way worse after COVID, by the way. Some of the hip flexor muscles, psoas, major and minor, they attach to the lumbar vertebrae. So if you become very stiff there, then when you stand up, that pulls the vertebrae forward and creates like what I would consider like a functional stenosis, or a narrowing between the vertebrae. So this is like epidemic levels, like stiff hip flexors in our society, at least, it's super common. But I just said that hip flexors are overrepresented or overdiagnosed. What I mean by that is just if you get pain in the front of the hip, everyone just assumes it's hip flexor. There's a whole bunch of things it can be besides hip flexor. Okay, so that's the adaptation piece. The protection piece, so what creates tone? So tone is the word we use for the stiffness. Like hypertonic means too much tone in the muscle. What does that is the nervous system. So the nervous system is protective. It's there to keep us alive. And so if it senses a threat, it's going to have some sort of workaround. So if the nervous system perceives that the muscle can't be strong at the end range, it's going to create tone at that end range. So that's a very important concept, because that is part of the solution, how to create more mobility. So let's get to that. How do we fix it? How do we get better flexibility? Now, there's more than one way to skin the cat. There's definitely not one right way, but this is the method that I use that works pretty darn well in my experience. I've been doing this about since 2013 for a while. So I like to do something to modulate the nervous system first. So that's like soft tissue work. So I'll usually massage or scrape or cup. If you're doing this on your own, you could foam roll, massage gun. It doesn't really matter. You could like do tempering, which is like using a barbell or like something weighted to roll the tissue. And now the goal here is not to crush the tissue. You can definitely over-treat a muscle. You're not trying to break up knots, break up scar tissue. All that stuff is not really what's going on. We're trying to give the nervous system input to affect how it's handling the tone. There's a couple different approaches here and different ways to think about it. So it kind of depends on the scenario, what I choose to do and how much pressure to put in. So one idea is, this is kind of the pain science idea, that the nervous system has perceived a threat in the area, so it creates stiffness. So if you modulate the nervous system through some noxious techniques like scraping, cupping, deep pressure, and nothing bad happens to you, like the muscle doesn't come tearing off the bone, you don't die, then it has the effect of turning the signal down, the alarm, and then it will reduce the tone. That's one way to think about it. Another way to think about it is that our nervous system is sort of chronically in the sympathetic state. And when you're in that fight or flight state, your nervous system thinks you're about to get in a fight or run, so it stiffens the tone in the muscles. So you can, if you do something that feels kind of nice, so that hurts so good kind of feeling, like massage, you can trigger the parasympathetic nervous system, the relax and digest, which decreases the tone of the muscle. So that's where I start. And generally, people love it; they feel good, and suddenly they're like, "Oh, that stiffness feels way better already," just through some hands-on stuff. Now, some rules to live by if you're doing this on your own. Again, don't try to crush your tissue. Don't try to work out that knot. You want to make sure that you can breathe. Right. So if you're holding your breath, the amount of pressure you're putting in the tissue is too much, and it's going to be counterproductive. Right. Holding your breath, it's technically a type of sympathetic state. Also, if you feel that you're guarding, if you're rolling on a ball on your butt because your piriformis is painful, and you're clenching because the pain is so intense, that's too much. That's way too much. Dial it back, use a softer instrument, or take some load off of the instrument, and make sure you can relax into it. The other thing, too, is respect the nervous system. So if you sit on a spot and you get a signal traveling down your leg, that means you're sitting on your sag nerve. That's not a good idea. Don't pressure your nerve. Outside those rules, mobilizing yourself is pretty easy and pretty hard to do any damage. It only takes a few minutes, too. You don't have to be sitting on a foam roller for an hour. So then what happens next is that's where you start to do the mobility work or the stretching, whatever you want to call it. This is where passive stretching can be helpful. A lot of people say it doesn't do anything. Well, if you do it in a certain sequence, it can be beneficial. When I was talking about before active versus passive, chasing sort of that passive zone, that's what you're trying to do here. Take the joint to the end range, spend a little time there, Make sure you can breathe in that position. By the way, that's also key. I can't remember who said, I think it was Gray Cook, that if you don't breathe in a position, you don't own that position. Again, you're kind of talking to your nervous system saying, hey, I'm in this end position. I can breathe. It's going to be okay. Turn down the alarm. All right, so after you've stretched it passively, then it's time to move into that new range of motion that you just bought. So say you picked up 5 degrees. Now you spend a little time working on the strength there so you get to keep more of it. Or otherwise, you just stiffen back up to where the nervous system feels safe. This is where contract or relax stretching can be pretty beneficial too. So P&F stretching is called. You're basically taking the joint to its end range. You contract in that position, and then you move a little further, you contract again, so you're teaching your nervous system it's safe, and you can be strong there, and generally you get faster results that way. So let's put this all into example. So we'll use the hip flexor patient, or many patients I see, as an example. So say you're stiff in the hip flexors, and you have to evaluate this. You don't just guess on the stuff. So first, I would probably do some soft tissue work on rectus femoris, which is one of the long hip flexors. It's a weaker hip flexor, but it's involved. So down-regulate the anterior part of the leg. I could scrape it, cup it, massage it. You could roll it, whatever you like. And by the way, I like to do that in a lengthened position. So I at least will bend the knee a bit, not just with the legs out straight. So that just kind of exposes the tissue so you can get more input into the nervous system. Then I would either manually stretch the person or teach them how to stretch on their own, which is usually what I end up doing. I would do something like the couch stretch. So that's something that's been popularized by Kelly Starrett, and it's a great stretch. So I treat a fair amount of older folks, so getting on the ground is not always the best for them. So I'll often use an incline bench and put it to a decent, maybe like a 45-degree incline or greater, depending on where they're at. And then you put your leg on the backrest. So you think your shin's on the backrest, your knee is in the crevice, and then you stand up. So one leg is behind you, and that's a pretty darn good stretch for most people. You can make it more intense by kind of squeezing your glute, which is a good idea. The more you can get active into these things, the better it is. And then spend a few minutes there, make sure you're breathing and all that. It's called the couch stretch because you can do this on a couch too. You just put your foot up on the backrest, shin against the back side of the couch, and you just stand up tall. Right? So after spending a few minutes doing that, then it's time to get more active and train the nervous system. I'm strong here. So then I'll almost always move right into a Bulgarian split squat. So that's where your leg is behind you, so the same exact position as the couch stretch. And you go into a deep, knee to ground split squat. And I will usually instruct push off both legs for the idea that we want the stretched leg to be active. And you do a lot of reps there. And you do that over time. You do those 3 things, and range of motion improves. It's almost a guarantee. So if I was to make a quick little template, it would be step 1, neuromodulate the area. Step 2, stretch the area. Step 3, activate the area. So let's take one more example. We'll do the ankle, since that's such a common deficit. So if you're missing a dorsiflexion, like in that squatting example, you would neuromodulate the tissue first. So that could be foam rolling the calves, lacrosse ball, having someone massage it. A few minutes doing that. But then you get on like a calf slant board. All this stuff, by the way, you can go to my YouTube channel and find all this stuff. Get on the calf slant board, take the joint to end range, spend a few minutes there doing a calf stretch. This is where it'd be good to know if you have a stiff capsule too, because there's things for that as well. And then you would do something to strengthen the calf at the end range, provided that the calf is the issue. So you could do heel raises on the edge of a step so that your heels sink all the way down and spend a fair amount of time at the bottom. Oh, and I didn't mention eccentrics. That's probably another good tool that fits in this mix here. Eccentrics are negative, so the lowering phase is the eccentric part. So spend more time on the eccentric versus the concentric part, which is the going up. Another thing you could do, I like to add like a Jefferson curl on that slant board. So if you're stretching your calves, the same angled incline that you're standing on, you grab a light kettlebell and just bend over and it's almost like a deadlift in a sense. That just gets the whole posterior chain activated. That's just another option. Now, again, don't just guess on these things. Get things evaluated, especially if you're having a pain problem. Now, I'll tell you, a lot of therapists out there, and maybe you're listening if you're a therapist, they think that manual therapy doesn't do anything, all the hands-on work. I totally disagree. Now, is it a necessary step? No, but I just know from years of doing this that you get results faster if you throw that in the mix. Okay, I think that about wraps it up. So if you have questions, feel free to email me. And that's all for this week. Talk to you soon. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.